Hello, everyone. Hope you're enjoying the weather. I'm Dr. Puja Patel. I'm a health psychologist, and I've had a specialist interest in perinatal mental health since I graduated uni over, I don't know, 9 years ago. So I've always worked in those services. I now work in consulting and training. So I've kind of combined my knowledge of what I've picked up over the years around perinatal mental health, combined with conversational skills, clinical skills. So I do various bits of training. So I think today's webinar is more focused on just awareness around what perinatal mental health is, and some tools and techniques that might be useful in your practice, or if you're working with families around how to kind of engage and work with them in a more kind of effective and meaningful approach. So I pulled out some learning objectives. Don't worry too much, but essentially this kind of webinar will hopefully help to cover and help you to understand the common kind of psychological changes that can affect the mother during the perinatal period, understand how to support parents through those sort of challenges during that period associated kind of with a new baby, and how that can impact a mother's mental health and well-being. And then also understand how to effectively provide meaningful advice and signpost where necessary. So I've got 3 or 4 kind of tools and techniques that you can use in practice. That they're very brief interventions that you can kind of pull out and use in practice. So what is perinatal or perinatal mental health? Perinatal is just a kind of fancier word of combining that antenatal period and that postnatal period. So it's during or after birth or delivery. When we talk about perinatal mental health, sometimes you might have heard the term maternal mental health as well. It is a very common issue within the UK. Almost 1 in 5 will experience a mental health problem during or up to 1 year after having a baby. Sometimes we hear the term baby blues. So that's usually in the first 10 days after delivering a baby. But post that period and up to a year after, that's classified as postnatal depression or anxiety. Around 70% of women will hide or underplay their symptoms, and that could be down to, various different factors such as stigma, not actually being aware of what they're experiencing, or not kind of having that support system to kind of discuss their feelings, or not having that opportunity to discuss in clinical settings what they're experiencing as well. Suicide is the leading direct cause of maternal deaths up to a year after having a baby. So that's in very serious cases. And I'll kind of talk to you a little bit about the spectrum as well. And there's lots of different examples of perinatal mental health problems, which includes that antenatal or postnatal depression, anxiety, obsessive compulsive disorders, postpartum psychosis, PTSD, and it is on that scale from mild to severe, just like any other kind of mental health problem. So what are some of the signs and symptoms? Now, these are just some signs and symptoms. There's this list could go on, but some of the kind of more common signs and symptoms are things like crying often, disengagement. So that might be disengagement with services, not connecting with family or friends, disengagement with the baby. Lack of attention or concentration, so not being able to concentrate on tasks, and this can happen during that antenatal period or postnatal period, so it doesn't have to just be after birth. Generally reserved, so they kind of might retract in their behaviors. In kind of more serious situations, intrusive thoughts about harming self or baby. So these are just thoughts, they're not kind of acted on. Poor self-care or self-neglect, so hygiene practices, just generally not kind of looking after oneself. High levels of anxiety or worrying about the baby. In my previous role, we had a lot of women who suffered prenatal anxiety, and that could be because of worries about giving birth. Perhaps they've had a traumatic birth beforehand, and worrying about the baby. So, I've worked with women who will constantly sort of watch over their baby to check their breathing, and that's quite a common kind of thing to experience, especially if you've experienced something quite negative in the past. Sorry, feelings of guilt, lack of energy, overworking. So this is one kind of sign and symptoms that often gets overlooked, actually. So this is perhaps more a sign of pre or postnatal anxiety rather than depression. So overworking, constantly doing tasks, not resting, and that might be a sign of they're trying to mask something. And just a general change in character. So these are just some of the signs and symptoms that we can pull out in terms of pre or postnatal anxiety or depression. There are lots of different variables and risk factors around developing perinatal mental health complications. Again, these are just some. This is the biopsychosocial model. So it kind of looks at how, that there's not just one kind of sole reason or risk factor around developing perinatal mental health problems. And, just like any other mental health conditions or issues, anyone can experience perinatal mental health. It doesn't discriminate. So in terms of biological factors, it could be things around fertility issues, whereas it could be birth trauma or OBS and GYNs complications, breastfeeding complications, hormonal fluctuations. That's very common in the first couple of weeks after delivery. Any other kind of underlying health conditions. In terms of psychological risk factors, previous mental health issues. We know that if you've experienced previous mental health issues, you are more at risk of having pre or postnatal depression or anxiety or that perinatal mental health issues. Birth trauma it is a big one that's often overlooked as well. So a traumatic birth first time round, that's going to raise some issues, raise some concerns as well. Substance misuse problems, so addictions, like I said, previous history of pre or postnatal depression, unplanned or unexpected pregnancies. That's quite common in young parents that I've worked with, or a loss of a child or a miscarriage as well. And then it's, in terms of social factors, things that need to kind of be, or things that could be risk factors are things like our postcode lottery, where we are placed, where we are living, that could impact access to services, access to social support, and so on and so forth. Lack of family or social support, lack of access to services, lack of funds, poverty, age, language barriers, abusive relationships. So these are some of the social factors that can, I would say, are variables around developing perinatal mental health complications. And then I've pulled out 4 groups here that often get fall through the net. So like I mentioned earlier, anyone can experience perinatal mental health problems, from mild moderate to more severe complications. But there are groups of women, or I should change that, there are groups of people who may go unnoticed or undiagnosed. So these are groups such as ethnic minority communities. So there might be recent migrants to the area, experiencing language barriers. They may have a lack of trust with services, in which case they may not engage with services, or may actually not know or understand the maternity kind of pathway in this country. They may have experienced some racial bias, and also cultural norms and values may not align with the healthcare models here. So a lot of my previous work was working with different communities and doing outreach work to kind of understand different cultural norms, traditions, customs, etc. Sorry. And then there's marginalized women. So these are often women who experience external or internal stigma. So external stigma is often what people tell us about us. Internal stigma is when we really start to believe that. They may be worried that social services will remove their children, particularly those women in abusive relationships who are unable to flee or who have had children removed in the past. The other group is young parents, and that might be because of lack of family support, unexpected pregnancies, financial pressures and other pressures that they're going through. And then partners and fathers. So same-sex couples, fathers, partners often get missed. So these are just some of the groups with unmet needs that we may tend to kind of not pick up on. So this is just kind of another sort of way of describing that perinatal period. We know that in that prenatal period, so sorry, I'm saying prenatal, perinatal, antenatal, there's a lot of terms associated with it. But when I talk about the prenatal period, that's the same as the antenatal period. So we know that high levels of stress and anxiety means increased levels of that hormone cortisol, which is associated with low birth weight. So this has an impact directly on the baby. Depression within that prenatal phase can also kind of impact low birth weight or premature births. Now, if this isn't picked up in those early stages, there is a potential for these things to worsen in that postnatal period. So not only kind of will mom be struggling, but also baby as well. So there may be poorer attachment styles due to maternal distress. There may be withdrawal behaviors or anger as a coping style in children, or kind of lower cognitive functioning in children. And again, this is in slightly more severe cases. And that has the potential to persist in later life, so it can become quite intergenerational. It is important to note that not everyone will experience these issues, but why I'm highlighting this is because seeking support early on is really beneficial in preventing adverse outcomes for both mom and baby in kind of that postnatal period. So that's kind of an overview of what perinatal mental health is, what pre-postnatal anxiety depression can look like, and the impact it can have on moms, families, and babies. The second part of this is really kind of doing a little deep dive into conversational skills for families experiencing perinatal mental health issues. And a lot of these tools have been sort of tried out. They've been kind of pulled out from other training that I deliver, but they're really useful kind of brief tools that you can use in practice. Some of it you may already be doing, so it might just be kind of a refresher and just a reminder on kind of the importance of some of these skills. So first of all, I'm going to talk about the writing reflex. We often have a desire to help people in need. So if someone comes to us with an issue or a problem, or is presenting a problem to us, so if we've picked up that the fact this mom's really struggling and they're presenting a problem to us, we often in this helping profession have a powerful desire to prevent harm and make things better. And this is known as our writing reflex. It's because we're empaths, we're in this helping profession, we've got the answers, we know what's going to help them. However, if that person verbalizes their own reasons for change or their own kind of ideas and suggestions on what they think they should be doing, they're much more likely to make that change, and it's much more sustainable over a longer period of time. So kind of as we go through this training and hopefully in your practice, just kind of resist that writing reflex. Try not to fix everything, because one, we can't, and two, it's better if it comes from the other person. So just be aware of that writing reflex. So quite an important part of any conversational skill is expressing empathy. But why am I showing you these images? So we're all looking at the same thing, but we're all coming from very different perspectives, different angles. We've seen different things to begin with. However, I understand and accept that you see a blue and black dress, even though I can't see it right now. I understand and accept that you see that. I also understand and accept that the first thing most of you saw was an elderly couple, in that middle image. The first thing that pops out to me in that image is the vase in the middle. And it's not until we kind of talk about it, we sort of pick up on what everyone else is seeing. And then in the last one, this is a very it's from a very, very old psychology textbook. Until you kind of see that second face, it's very difficult to get there unless someone's sort of guiding you through it. And that's what expressing empathy is. It's understanding that person's point of view, understanding where they're coming from, and accepting that person's point of view and holding them. So you're almost holding emotion. Expressing empathy in practice is really important. People actually feel that. So when you're empathizing with their situation, so that's different to sympathy. Sympathy is, I'm sorry this is happening to you, but it's not happening to me. Empathy is, I understand and accept this is your point of view. And it's a core skill when we're working with anyone in practice. So again, just another thing to kind of remember, and most of you probably already know this. So some of the skills now that I'll talk through are a bit more practical skills that we can use in practice. So being curious is really important when we're working with families, when we're working with moms. It's a way of, let me just go to the next slide. It's a way of getting the other person to think and reflect. So earlier I talked about the writing reflex. If we jump in too quickly with solutions and ideas, we start to disengage with people because those solutions, those ideas, those suggestions haven't come from that person. They may work for us, but they might not work for the other person. So we want to stay curious. So curious isn't being nosy. Curious is having a genuine interest in what that other person has to say. When we stay curious, we get people's opinions, we get people's feelings and wants, and it hands the control of the conversation to the other person. So for example, it could be really simple what and how questions. What's important for your well-being in your view? What does this mean in your culture? Tell me a little bit about these thoughts. How have you been doing today? What does that mean for you and your baby? The tell me more questions are always my favorite, because it helps people to kind of feel at ease, and you can capture a lot of information even in a short space of time. So staying curious is another kind of term used for open discovery questions. So we know open questions are those questions that can't be answered with a simple yes and no. Open discovery questions goes that one step further and removes that judgment element from the question. So they are those what and how, tell me a little bit more, those sorts of questions. We try and avoid when I say we try and avoid the why questions. I can understand sometimes it might come up in conversations, and that's fine. So why questions can sometimes feel a little bit judgmental, but I wouldn't worry too much. It's just about being curious. The other skill is the power of affirmations. Affirmations is the one skill that's used least in practice, but it's actually one of the most important ones as well. So these are generally direct statements that support and comment on whoever we're working with, their strengths, motivations, intentions, and progress. So if they've made a suggestion, for example, maybe I could try this, maybe I could go for a walk today. It's really important that we throw in an affirmation and it's genuinely felt. So it could be, something as simple as that's a really good suggestion. These may feel like small steps, but you're making huge leaps. Thank you for giving it a go. That couldn't have been easy. So very simple, but really effective. And actually, recent studies have shown that it can lower distress in others. So where you can, throw them in and they don't feel patronizing, because often that's the worry, that they feel quite patronizing, but actually for the person receiving them, it feels like they're being heard. So another skill, and this is something that I spoke to a midwife around, is setting and discussing an agenda. So if you go into a consultation or you've got a meeting with a parent, whoever it might be, setting an agenda can be done within the first few minutes of a conversation. And what it does, it provides focus to that conversation, so the other person feels like they've gone away and achieved something from that session, however small it might be, even if it's a 10-minute conversation with someone. I've got an example script here, and you can, I think you'll get these slides so you can adapt it and change it to however you like. But a really simple example here is, we have 20 minutes today. So taking that word only out, because if we say we only have 20 minutes, it feels quite restrictive. So we have 20 minutes today. I'd like to start by hearing what you would like to talk about, or what would you like to discuss today? And you can go in with a agenda matching sheet. You can go in with certain topics that you can cover in that session, and then prioritize. So because we have 20 minutes today, which of these is most important to you? And then you verbalize your agenda. So the main things that I'd like to ensure we cover are, your well-being, your something you mentioned earlier, whatever it might be. Would it be okay if we focus on X and Y from your list? X from my list and Y from your list, and then speak about Z at our next appointment. And that's just a really simple, you've just set an agenda within the first few minutes. That provides focus for you and the other person. And it kind of just helps, again, like I said, helps them to feel like they're going away after that session with you with something tangible. So that's agenda setting. You can also, I don't know if anyone has heard of giving brief advice or ask, advise, assist. This is a really simple tool as well, and it comes with practice. It's used often when we spot opportunities to talk about a certain issue. So if they've brought up their mood, low mood or anxiety or worries about the baby, we can ask them those open, curious questions that we just looked at in the previous slide. What do you already know about the issues? What do you already know about postnatal anxiety or low mood? And if they don't know too much, that's when we provide some advice. So we might offer advice in a way of saying, would it be okay if I give you some recommendations? Or would it be okay if I offer you some advice? And if they say no, we don't push. If they say yes, we continue with that conversation. And it could be whatever advice there is available in your local area, or recommendations, so on and so forth. And then you assist. So if it is something like wanting to, there's a service that can support this mom during that postnatal period, you can ask them, would you like me to make a referral? Or would you like to take this phone number, a website link away? Whenever you give any kind of website links or leaflets, explain what that is. Because quite often we get given lots of different information and leaflets and it's just stuck at the bottom of our bag. So it's important that we explain what that is, and then ask, is there anything else you need? This is a tool that can be done within 3 minutes. So if you type in making every contact count on Google, it comes up with loads of different examples on how you can kind of have this conversation within a 3-minute conversation. So this is Ask, Advise, Assist. So when you spot an opportunity to make a referral, a signpost, or give information, essentially. And then I've got 2 other tools that are very, very similar. So the PAPA tool, would it be okay if we talk about low mood? Ask them what they already know about it, or ask any other kind of curious questions about it. And then provide. So here is some useful information. What do you make of this information? Do you want to take it away and think about it? Or would you like me to make a referral? So that's the PAPA tool. And then there's the Ask, Offer, Ask. Again, it's the same concept. Would it be okay if we talk about low mood or your anxieties? If you're open to it, would it be okay if I share some information? So each time you're kind of asking them, would it be okay? Because if they say no, we don't want to push. But if they say yes, then they're open to having that conversation. And actually, they retain more information if it's coming from a place where they feel safe. And then again, ask, what did you make of that information? And you can assist in whatever way that looks like. So these are just some really simple tools that you can use in practice, giving brief advice and signposting efficiently. Any questions?
So this was, unfortunately, I've had bad experiences being hired by mothers who at first seem desperate for help, but once you start taking care of a baby, they get extremely aggressive towards you, jealous, and cause lots of drama for your every action. Could this be a sign or symptom of a mental health problem related to pregnancy and after pregnancy?
I think it depends, one, on what your role is, and 2, whether they're ready for support. So it could be a sign or symptom of a mental health problem related to pregnancy or after birth. But I think it's, let me think about this question. I think it largely depends on what your role is. So if we're kind of going in and we are, we're not offering the space for that woman or that person or that mom, I think you would get a lot of aggression and kind of that kind of feeling coming back. It goes back to the writing reflex. How much are we trying to fix the problem? And how much are we just stopping and listening and trying to understand what their point of view is and why why they're kind of presenting themselves in that way. But like I said as well, mental health is on a spectrum. So yeah, I think I'd need to know a little bit more context to answer that one.
Okay, thanks, Puja.
Yeah.
Okay, we've got something else. From Mona, is postpartum depression too bad? And how we console the patient or person?
Is postpartum depression too bad? So it depends on a spectrum. We have to look at things like who's in their social circle, or what's their social support system looking like. Why are they experiencing postpartum depression? How do we consult a patient or a person? Okay, so again, it depends on probably your profession as well, or if you're trying to console a family member or a friend, because that's going to look a little bit different. If it's in either situation, coming from a place of empathy is really important. So stop and listen and try to understand what they're experiencing. If we again jump in too quickly and say, well, have you tried this before, or have you gone out for a walk, or why don't you just do this, we will disengage with that person. They're not going to come to you for support. So we have to be really careful in terms of how we offer our support to someone. And most often it is just kind of stopping, listening, and understanding their point of view.
Gigi has just commented. Let me just see. All right, I think Gigi is trying to give some more context to her question.
Okay.
So I was hired to be a maternity nurse for a newborn baby. At the first night, the mother became extremely aggressive, questioning every action of me towards the baby. She was living 24 hours a day, checking the cameras inside the baby room. Well, it was a nightmare because she was disturbing the baby routine. I noticed that everybody who used to come close to the baby, even the husband, was suffering with her jealousy. Okay,
right, that gives more context. That sounds a bit more on the severe spectrum. And perhaps there's something around, we didn't really touch on it today, but around, and I'm not trying to diagnose or anything, but it sounds a little bit more like postpartum psychosis. So yeah, perhaps it's more on that higher kind of spectrum, more that severe spectrum. And if that is the case, those sorts of kind of reactions are typical. That's kind of what you would experience, and what you would see as well.
Thank you for watching our video. For more London School of Childcare Studies content, see our social media or visit our website childcarestudies.co.uk.